Hi Dr. Sandeep. My relatives has breast cancer. What are the tests to detect and when to start the tests?
The whole idea of identification of breast cancer early has come up because of the specialized tests that are available for breast cancer detection. Now, there are two ways you can detect breast cancer. One is the tests which will detect it before the first signs of breast cancer is seen. We have already discussed about the breast cancer signs, early signs in our earlier videos. The idea of the test is to detect it even before the first sign appears. Can it be done? Yes, it can be done very well. So, how do we do it? There is a test called mammography. In fact, many of you might have heard about it. So that is the test which is designed to detect those small changes, very tiny changes in the breast, which will indicate that there is a chance that there may be a cancer. So that is the idea of doing mammography. We will be covering what is mammography in more detail as we go on in the series. But what you have to understand about mammography and the result that comes out of it is that whenever mammography is done, it detects very small changes like what we call as microcalcification or some architectural changes. Means it will tell us that there is something abnormal. And what do we do when we see it? We go ahead and do a biopsy. Biopsy means we take a small amount of tissue from there using a needle and test it under the microscope. So that will give us an idea about whether this looks dangerous or it looks safe. So the entire idea of doing mammography is not that you are having a problem already. In fact, it is done when you don't have any problem. So when do you decide to do it then? So that is an important question, because if you don't have any problem, then there should be a reason to do it. So it is done only when you have crossed a certain age, which means a cutoff age group beyond which your risk of breast cancer is higher. So generally in practice we believe that 45 years of age group is the age group wherein we can start doing mammography. So a mammography done or begun at the age of 45 and above, which is done once in a year, to a great extent detect about 70% of the cancers, breast cancers. 70% is good enough because when we detect 70%, we can prevent a major treatment in that 70% of the patients. So it is always worth doing that test to detect maximum amount of breast cancers before even they produce the first sign or symptom of cancer. The second important thing that has to be done or followed is that every woman should do breast self-examination once in a month. Now, this once in a month examination generally has to be timed in a particular fashion. See, now when we are talking on breast self-examination, which will be covered in detail in our next few videos, but what is it that we are talking about? We are talking about the woman examining herself in various ways and looking for any changes in the breast. So if she sees some change, that needs to be further investigated. So it could be, or it has to be brought to the notice of a qualified doctor, so that further things can be done, further tests can be done, we can confirm what it is. So the entire idea of breast self-examination is to raise a suspicion and come to a doctor. How it has to be done will be described in detail in our ensuing videos. Now once that happens, we will be able to detect a cancer little earlier than in an advanced stage. What age do you have to really start it? We would advise, or internationally we advise every individual to look at their or examine their breasts at least once in a month. Now how do we time it? Timing is also very important. In a post-menopausal lady, that is people whose menstrual periods have stopped, it is to be done once in a month on a fixed date. You fix a date, say 1st of every month. That's perfectly fine. Whereas in a person who's menstruating, it is important to time it in such a way that it is about 1 week after your periods are over. so that you get used to a particular consistency of the breast and you can find out, okay, this is how it feels. So any change in the breast can be reported, or you can go to the doctor for further treatment or further diagnosis. What age do you start this? Internationally it is advised to start at least at the age of 20. So it is perfect. Anybody, any person above the age of 20 can start. It is simple. You're not testing, you're not going to a doctor, you're not doing anything else. It is done in your bedroom, in your bathroom. So it is as simple as that. So, with these measures, you will be able to detect anything that is suspicious, and you can escape going through an extensive treatment. You can make it very, very simple for yourself.